Good evening. Welcome to the League of Women Voters of Larimer County's Candidate Forum. Tonight, we'll hear from the candidates running for the Board of Directors of the Health District of Northern Larimer County. I'm Jory Kramer from the League of Women Voters of Larimer County, and I will serve as moderator this evening. This forum is being recorded, broadcasted, and live streamed by the wonderful staff at FCTV. The recording will be available later on the League's website, lwv-larimercounty.org, and also at vote411.org. The League of Women Voters is a nonpartisan political organization that encourages members to be active in local government. The League does not endorse political parties nor candidates. When a League member is a candidate, they are treated the same as other candidates and are not included in any planning of the forum. 7 candidates are running for 3 open seats on the Health District Board of Directors. 6 are joining us tonight. They are in order of appearance on the ballot, starting on my left: Lee Thielen, Avril Strand, Sylvia Tatman Burris, Julie Field, Adriana, sorry, I got it right in practice, Adriana or Adri Santiago, and Nicole Coco Peterson. Sarah Hathcock is also a candidate but is unable to join us tonight and has submitted statements that I will read. During the forum, each candidate will have 90 seconds to give an introductory statement. Each candidate will then answer a series of questions and will have 60 seconds for their answers. Then the candidates will give a 60-second closing statement. Candidates, we ask that you adhere to the time limits. To help you do that, our League volunteer and president, Pat Berger, who has Oh, there she is. She'll be sitting down in the front. She will be helping you stay on track. She will hold up a yellow sign to indicate when you have 15 seconds left, and then a red stop sign when your time is up. Thank you to our audience for joining us, both those in person and those watching at home. For our in-person audience, in order to allow the maximum amount of time for questions, we ask that you do not express support or dislike for an answer or a candidate. Please hold your applause until the very end of the forum. The candidates have not seen the questions they will be asked this evening. Our in-person audience has the opportunity to submit questions for the candidates. League volunteers have provided cards for you. Please write your questions on the cards, 1 question per card, and then hold it up. And our League volunteers will collect it and get it to our question sorters here in the front, who will edit the questions for clarity and repetition if needed. We most likely will not be able to answer all the questions tonight, but the candidates have agreed to stay after the forum for a meet and greet, and you'll have the opportunity to speak with them then. All right, we will now begin with the 90-second opening statements from each of the candidates. And candidate Thielen, we will begin with you after I read candidate Hathcock's opening statement. So this is from candidate Hathcock. Hello, and thank you so very much for allowing me. Oh, and Pat, please time me on this. Okay. Hello, and thank you very much for allowing me the opportunity to introduce myself in this forum, and I wish that I could be there in person with you this evening. My name is Sarah Hathcock, and I'm a local pediatrician who has been a part of this community since 2016. My husband and I live with our 4 school-aged children in Fort Collins. I am running for the Health District as I am passionate about utilizing my skills, training, and abilities to help improve access to health services for vulnerable populations in our community. With a background not only in clinical medicine, but also in public health, I believe that I would bring a very unique and powerful perspective to the Health District Board. I have served the health needs of children in Larimer County for several years at Salud Family Center in Fort Collins and have intimately experienced the challenges faced by local families. Through my work, I have also gotten to know the amazing web of community organizations that dedicate themselves to various facets of addressing healthcare needs in our region and feel that my relationship with these organizations would be a great asset to the Health District and Board. We are strongest as a community when we work together in collaboration. All right, there we have it. So, Candidate Thielen, we'll turn to you now.
I love that title. Thank you.
You're welcome.
First of all, thank you to the League of Women Voters who do such a great job with these candidate forums. I appreciate all that you do. And to the city of Fort Collins that is so hospitable about helping us put this on, helping you put this on. And I'm happy to be here with the other candidates tonight. First of all, why am I running, or why do I care? I love the health district. I absolutely love the health district. It is a unique asset that no other community has that I know of. It's funded locally. It's got solid, predictable funding. Its mission is to fulfill the gaps in community health in the community, and that means that it needs to be flexible and able to respond to changing conditions or crises. And I really acknowledge the importance of the mental health services. The dental clinic is totally unique. Thank goodness we have it in our community. And of course, helping people with the complexities of health insurance is a real gift. In the past, there have been other services. In the future, there will be many different services. I'd like to say that one thing that you should keep in mind about the health district is it's local dollars at a time when federal dollars are being whacked. That makes what the health district does more important than ever. Thank you.
Thank you. Candidate Strand?
I also would like to thank you as the League and the City of Fort Collins for the building, and those of you online watching, as well as those of you in the audience for attending in the snowy evening.
Good idea.
I'm very interested in serving on the board because I strongly want to support the governance of this organization and assure that we have fiscal accountability and organization responsibility. The Health District is a unique gap-filling organization that is a real gem for this community. I in the past, I was the Director of Health Services for Larimer County Department of Health and Environment, and we partnered with the Health District when we were unable to meet all of the needs that we had through public health. The district does a wonderful job of community assessments and needs to continue doing that. They need to continue looking at direct services as well as partnerships. And I'm especially interested in providing the low-cost dental health services as well as, I'm sorry, I guess I have to stop.
Thank you. Candidate Tatman Burris?
Great. Excuse me. Thank you so much. And thank you to the League for hosting this forum this evening. And I'm really excited to have this conversation with our other candidates tonight. As mentioned, I'm Sylvia Tatman Burris. I am a long-term resident of Fort Collins. I graduated from Centennial High School right here in the community. And I see this really as an opportunity to give back to my community that has offered me so much and offered me so much opportunity in my lifetime. And I am currently working for the city of Fort Collins, and I have for about 8 years. I'm a policy and project manager with the city manager's office. I work across many departments to alleviate issues between departments, and I also work a lot with city council. And so I see those experiences as really helpful to possible candidacy and work on the health district. And then I'm also a single mother in this community, and I know that there can be a lot of issues accessing things like childcare, healthcare, behavioral health. Those services are really important to a vibrant community, and so I see the health district as playing a really important role in many of those services, certainly through direct service and also through partnerships that we have in the community for those populations that are served by those different partnerships. So really appreciate, again, the opportunity tonight, and thanks for those joining us this evening.
Thank you. Candidate Field.
All right, thank you. Thank you to the League. Thank you to everyone who is so interested in this very important election. I really appreciate that. I am retired Judge Julie Field, and I am running for re-election to the Health District Board. I've lived in this community for over 25 years, but I was literally raised in community health. I grew up in my father's small town pharmacy in Nebraska, where he taught me two things between counting pills and making malts. That was everybody counts or nobody counts. The second lesson that he taught me was that you create partnerships in the community to help the community, particularly around health issues. And that you need to do that in a nimble way that is able to meet the moment and the challenges when things change. To me, those two messages mean health equity. Everybody counts or nobody counts. And meeting the moment means building partnerships, measuring outcomes, using evidence, and being nimble. I took those lessons with me from that small town pharmacy to my heart, to the court and the wellness court that I helped create, to the board, and I look forward to continuing service in this community. Thank you.
Thank you. Candidate Santiago.
Thank you. Wow, such good experience already from all of our candidates. I'm honored to be here with all of you. Thank you for joining in person, and those of you who are online. Hi, Mom, if you're watching. Hi, brother, if you're watching. Like I said, my name is Adriana Santiago. Currently, I am an Equity Resource Supervisor at the Colorado Department of Public Health and Environment. I have been living in Fort Collins for about 4 years, and I'm not going anywhere. I moved here from Baltimore, Maryland, and absolutely fell in love with this community. Since I've arrived, I have been involved in the community. I worked at the Family Center La Familia as a programs manager, very rooted in community engagement and elevating community voice. And I believe my experience in community engagement and outreach, as well as equitable grant making and grant distribution, are qualities that can only help improve the board. And I feel that their vision aligns with mine, and their strategic plan is something that I would absolutely love to be a part of, in ensuring that the community has quality, community-centered health services for everyone. And I would also really love to improve the visibility of the health district. So that's what I got right now. Thank you, everyone.
Thank you. Candidate Peterson.
I'm going to go ahead and echo what everyone said. Honored to be here. Glad you're be here. You are all here. I love community engagement, and I would actually, although I love everyone here, I would love to see more people here and more engagement. And so I think that's something that maybe we can all work on, because this does matter. And I think a lot of people are not really don't really see or understand what the health district does. And I think we should spread that because it is important. It is a gem, right? My name is Nicole Coco Peterson. I go by Coco. Please feel free to address me as that. But this is important for me because I live in this community. I'm raising my kids in this community. My husband grew up here. My in-laws still live here. We have used and received and love to share about these community resources and services. On a more professional note, I've worked in many varied different healthcare services and communities. I started as a personal trainer. I've worked as a exercise physiologist, an orthopedic technician. I've been in the yoga community as a practitioner for over 15 years. I owned a small business. I have worked in healthcare ethics, and I'm currently an abuse prevention educator at at a local nonprofit. I've also been really involved in grassroots efforts that really changed policy and legislation around the opioid crisis, and I'm just happy to be here.
Thank you. Thanks to all of our candidates for that. And we're going to move into the question segment of the forum now. And during this segment, you will each have 60 seconds to answer the questions. So, Candidate Peterson, the first question will go to you. And here it is. In what ways can the community support the health district and be involved in expanding and improving healthcare coverage?
Improving healthcare coverage, I believe, can be interpreted in many ways. I think really we first need to evaluate where the gaps in the needs are so we understand how we can help with coverage. And I think we need to really think creatively on how we do that by also really looking at funding and identify where those gaps are. I think community participation is integral. And so I think getting stakeholders, all of the stakeholders involved, is critical to that as well. Thank you.
Thank you. Candidate Thielen.
I love this question. And one of the reasons I love it is because what we're talking about here more than anything else is policy. And in my career, one of the things that I was privileged to do was to train new state health officers from all over the country on how to be a state health officer. And the one message I would drive home to them is policy trumps program. I hate to use the word Trump, but it really works as a verb. Policy trumps program. The health district historically has had a strong policy position. They need to work with the local representatives. They need to work with their local electeds and try to work on policy at the local and state level, because that's how you deal with coverage. Thank you.
Thank you. Candidate Strand.
The health district has been involved for years in doing a local community assessment, and they have done a good job, I believe, in getting the voices of those who often are not heard, the silent people who really need the services. And if we are going to get community support, we need to hear not just from the community leaders, but for those who are often quiet in the corners. We need to be sure that we hear what coverage they need, not what we think they need. And then we need to talk with all of the others in the community and partner to make sure that we're filling the gaps and not duplicating services. That's all.
Thank you. Candidate Tatman Burris.
Thank you. I believe the health district can work to expand and improve healthcare coverage throughout the community in several ways. I'd certainly echo candidate Peterson's statement about looking at data, that health data is really important to take a look at who we're serving and who we're not. I think through the health assessment is also really important, as mentioned by candidate Strand. Certainly also for those underrepresented and underserved populations, especially in the health assessment from 2022. Certainly the non-binary and transgender populations are not being well served in the community. So how can we serve those populations better through partnerships and direct service, and also leveraging the funding well in the community that we have? So thank you.
Thank you. Candidate Field.
Thank you. This question really calls for a dialogue, because the question is, how can the community support the health district to improve healthcare coverage? So what it's really talking about is making sure that we are getting the information as the health district and listening to what it is that the community needs, making sure that we are meeting those needs with measurable outcomes and building connections with different community partners, not just UC Health, not just Summit Stone and Salute and some of the traditional partners that we have worked very closely with, but also continuing to build connections with Poudre School District, with the city, with the county, and making sure that we are, as candidate Tapman-Burris said, dealing with and addressing those underserved populations that we're not paying, we need to pay more attention to because everybody matters.
Thank you. Candidate Santiago.
Thank you. I absolutely agree with the candidate's comments about assessment. I believe that that is a strong tool to help the health district continue moving in the right direction. One thing I want to elaborate on, though, is that community support piece. I think for the community, you are the experts, right? So you bring your expertise, lean into that when you're doing those assessments, when you're working with the health district, when you're advocating for your needs, and participating, of course. We need your voice at the table. And so I would just ask that the community be open and know that the health district is operating from a standpoint of trying to improve community. And this is a service for you. These are your tax dollars. So lean into that ownership and expertise. And if I am elected, I would love to support in that. Thank you.
Thank you, and thank you all candidates. We'll move on to question number 2, and candidate Santiago will begin with you this time. Do you feel that the current budget priorities in the district are fulfilling the healthcare needs of Northern Larimer County? Please explain.
Yes, thank you for that question. And what a great question to ask, right? I was just talking about these are your tax dollars at work. I did have the opportunity to look at the 2025 budget, and in comparison to prior years, at this point, yes, I do believe the health district has the appropriate budget and resources in place to be able to provide those services. I think one thing that the health district is trying to do that I would love to be a part of is bringing more collaboration and partnership to health district services and the different type of services that we provide. So I think that the budget does allow for that space. In addition to us providing those direct services as well. And by us, I mean the health district. That's all. Thank you.
Thank you. Candidate Field.
Thank you. I had the privilege of working on the budget and helping to create the budget. The budget followed a long and thoughtful process of creating a strategic plan. There was a partnership between the staff of the health district and the board that really set out the direction for the future of the health district. We named as our 3 priorities behavioral health, dental services, and access to care through the Larimer Health Connect program. I do believe that the budget is more transparent than the earlier budgets that I had the privilege of working on. The budget is clear and is also planning for a very challenging time that we all know is coming in federal and state funding. So absolutely, I believe that the budget priorities support the healthcare needs in our community, particularly behavioral health.
Thank you. Candidate Tapman-Burris.
Thank you. I'd just like to echo what candidate Field said about the importance of local funding. And I also agree with candidate Santiago that the services that are outlined within the budget support the strategic plan and follow direct service operation as well as increasing partnerships within the community. Those partnerships are going to be really important as we look to serve an increasingly complex community as we grow in population and in complexity of those that we serve through healthcare. I've also had the opportunity at the city to serve on a budget team for our budgeting for outcomes process, so I understand what to look for in a budget to support a strategic plan. So I think in looking at the budget, it also is important to be transparent when we're talking about public tax dollars. So thanks so much for that.
Thank you. Candidate Strand.
You know, I don't believe we're covering all of the health needs for northern Larimer County. Certainly, there are many, many needs, especially in the area of psychiatric services and prompt care. People have to wait a long time sometimes for those services, and they're not currently able to get in when needs are the greatest. I do believe the services that are being provided are definitely very important. I think getting people the access to health services and linking them to those services is something that people often have no idea how to get there, and they need that direction. So I think that we are providing good services in the district, but we need to really look at all of the needs. Thank you.
Thank you. Candidate Thielen.
This is the most interesting question as well. Related to budgets, I'm probably someone who has some unique experience. I actually ran Governor Romer's budget office for a while. And so, and of course, supervised the budget in the State Health Department for 16 years. I think there's nothing wrong with the budget as far as reflecting priorities. There may be problems with the priorities. And what we've been seeing is reduced services, not improved services, over the past year, particularly in mental health and then in stopping services. It was interesting to me that a neighbor said to me, "Oh, the health district, they do such a wonderful job with all those health promotion services and all." And I said, "They don't do that anymore." And another person I met at a totally different kind of meeting said, "Oh, the health district, oh, they're really going to be important now. The vaccinations are going to be really serious issue with measles." I said, "Oh, they don't do that anymore." So I think you have to look at the priorities. The budget's fine. There's plenty of money.
Thank you. Candidate Peterson.
I did own a small business and I am familiar with budgets, but not one this large or intricate. And so I first want to acknowledge that I have really looked at it and tried to pull it apart, but it is not my expertise. And I think to really have an opinion, I would like more knowledge and understanding, and I'm not afraid to admit that. So if I make the board, I would really like to pull apart the pieces and understand it more. That being said, I think this is a really high stakes, high stress time with uncertain times nationally and a cut in funding. And I think with any kind of budget, we need to be able to be nimble and pivot so we do not have a lapse in care and that we're really taking care of a most vulnerable that really might lose a lot of services that are essential right now. Thank you.
Thank you. And thank you, candidates, for those answers. We'll move on to the next round, and candidate Field, you will begin. And for this question, it's the Health District's 2025 strategic plan includes new hires. Will the possible decrease in revenue prevent these new hires from going forward?
Absolutely not. I can say with great confidence, having worked on the strategic plan, having worked on the budget, and the projection that we have made and the calculation that we have made with the leadership team and the board, is we have planned for a time of fiscal conservation that we expect to be coming. We saw that coming, and in many ways, I think we look a little prescient, and I'm pretty proud of that. So the Health District Strategic Plan will not be cutting services and has not cut services. The behavioral health services are still operating at the same level, and people, in fact, are getting in sooner than they were previously. So there's some misinformation that's floating around out there, but the strategic plan, the budget, is designed to move forward
Thank you.
in a positive way.
Thank you. Candidate Santiago.
Thank you. Again, based off of what I've seen in the budget, I believe that it does not limit growth for health district staff. I think the confusion or perhaps the misinterpretation lies in the fact that the health district is exploring options to collaborate and bring in additional partners, right? Yes, there's new hires. I don't believe the health district is going to limit their growth in any way. And I think that the strategic plan was well thought out by that current board. And I don't see that happening. So thank you.
Thank you. Candidate Peterson.
Again, these budget questions are difficult for me, but I do know candidate Fields has intricate knowledge and was a part of this planning that I was not. I have looked at the hires, and again, I think where my concern is that we are making sure that funding partnerships is really great in theory and strategy. But we also have to make sure that we are boots on the ground talking to the people that really have used those services and those community partners, and making sure that those have the effects and impact that we think they do. And that's really actually hard to do. And as far as some of the services, I do know, I had a friend call me yesterday that is having a child in crisis, and there are long wait lists, and there is problems in access for care. And I would like to see maybe some more hiring in that behavioral health area.
Thank you. Candidate Thielen.
There's plenty of money. I'm delighted that there's an expectation of hires because there are real gaps right now. There are no psychiatrists. As far as I know, there's no fiscal group at all. 8 out of 8 people resigned. And a generic company in the East Coast is doing the accounting. So that's not an issue. And by the way, 8 positions are being abolished this year at the health district. I think people ought to know that. It's actually 9, but one guy had already left. So.
Thank you. And I've just been informed we have technical difficulties with FCTV, so we're going to wait while they get the sound back on. Sorry, candidates. The Health District's 2025 strategic plan includes new hires. Will the possible decrease in revenue prevent these new hires from going forward?
From my understanding of the budget and looking at it, they have plenty of revenue to support new hires. And I hope that we can move forward in seeing some of those hires include a child psychiatrist, an adult psychiatrist, and a medical director, because those areas are all in need of coverage for the district to have the services in place, not just to partner with others to provide the services. So I believe the monies are there, and I think that they just need to be spent wisely.
Thank you. Candidate Totman-Burris.
Thank you. I agree with everyone who's answered the question that it's really about use of funds that are there. I believe the strategic plan does shift some of those priorities in a way that moves towards, while continuing those direct services, into more of those strategic partnerships within the community. And it looks as if by the budget that those can be sustained. I think if I were to be elected to the board, I think it would be on us to really take a look and stay engaged in that process. And so be engaged with staff in understanding the budget and understanding, what is the purpose of those new hires? Are we still moving towards those strategic objectives in the strategic plan? And so that would be of interest to me in that regard.
Thank you, and thank you, candidates, for those answers. We'll move on to our next round, and candidate Totman Burris, we will start with you. And here is the question. How is the board planning to hold leadership and themselves accountable for changes made to the overall vision to ensure that these services are still being handled by their partnership with Summit Stone and others?
Thank you for that. I think accountability, especially with public tax dollars, is very important. And so I think there are good ways to hold staff accountable to those things through good collaboration between board and staff, in asking those questions, in doing reviews of those reviews of data that's coming in about those partnerships, making sure that compliance is happening, that we're asking those questions and looking over those financial documents. And so I think that is one way that board members can stay involved in that process, and should be involved throughout, as would be guiding that process moving forward.
Thank you. Candidate Strand.
Excuse me. In order to be accountable, we need to be very transparent. And in that transparency, we need to collect data and we need to share that data for both the community, our partners, and with staff and the board, so that we can partner together to grow and change as necessary. We need to be very careful in monitoring the budget and keeping that transparent as well. And we need to go to our partners and make sure that we hear from them if the plans that we've put in place are working. We need to know if Summit Stone is being able to move forward with the agreement that they have. We need to know that we are meeting our side of the agreement as well. Thank you.
Thank you. Candidate Thielen.
Accountability is really important, and it's important in these contracts that are now the new thing at the health district, and it's important also in the regular work of the district. One of the things that if I'm elected, I would really push is that we listen, because there has not been a lot of listening going on in the past year. We need to listen to employees, we need to listen to ex-employees, we need to listen to partners, we need to listen to community leaders, we need to listen to clients without making a lot of changes based on what seemed like a good idea in the office. So there's a whole lot that has to go into paying attention to really listening to what needs are and paying attention to how the district can best respond to the community's needs. Thank you.
Thank you. Candidate Peterson.
I echo a lot of what has been said. I think accountability has a lot to do with transparency, and transparency has a lot to do with open communication between all stakeholders. And that includes asking those you're working for, the people you're serving, your community partners, employees, fellow board members, executive team, administrative team, and really getting a full look at and approach. And I think the other thing that there is room for improvement is how things are communicated or seen. We really, learn and digest information on lots of different channels these days. And I think we should be using other channels to reach our community so that there is more participation and communication, so we can understand if we are serving or if the leaders are doing what they should be doing.
Thank you. Candidate Santiago.
Thank you. I absolutely echo what the other candidates are saying about communication and transparency. I also wanted to add on top of that making the health district more visible in the community, that's going to bring that transparency, and that's going to make it to where we have to be accountable. And so I would hope that there's movement towards more visibility with the health district so that the community feels comfortable holding health district board members accountable as well as staff. Thank you.
Thank you. Candidate Field.
The question is about holding leadership and ourselves as board members accountable. That actually has been one of the main focuses that I have had in my time on the board, both in terms of ensuring that we have proper policies that are updated, current, and meet current law. But meeting the strategic plan goals that we have set for ourselves and the expectations that we have for great governance and organizational excellence. So I am working currently on ensuring that we have training for the board around those issues. We have developed, among other things, some FAQs that are on the front page of the website that talk about the current initiatives of the health district that go towards that transparency and make sure that we are meeting the community's needs and holding ourselves accountable.
Thank you. Candidate Strand, you will be the first for this next round of questions, or question, I guess. As a special tax district, the health district receives about $12 million each year from Larimer County taxpayers. Do you foresee a need to ask for more taxes? Why or why not?
Thank you for the question. I do not believe we need to ask for more taxes at this time. Not only does the district receive taxes from the public, they also do receive some funding from UC Health for the lease of the buildings that they have. They have an ownership there that many people don't understand or don't know about, and that really helps to provide funding and will for the future. So, no, I do not see that we will need to increase taxes.
Thank you. Candidate Tapman Burris.
Thank you. I think I would agree with what candidate Strand is saying about not needing more resources under the special tax district. I believe there may be some strategic partnerships and strategic funding opportunities that maybe as a board we should look at if I were to be elected. Are there other partnerships or other possibilities that may be left on the table for the tax district into the future? And so I would be interested in exploring those and certainly looking to really get at those strategic objectives and see if there are other ways that we could be serving the community. So thank you.
Thank you. Candidate Field.
I think that the health district has done a great job in terms of husbanding the resources that we have. I want to be sure that we are using the funds to our highest and best use. I think that the contract for services model will help to eliminate a lot of the overhead and redundancies that have existed in the past. And moving forward, I think that we will be able to provide better services and to have measurable outcomes. We don't need to ask the good people of this community for additional funds. I think that we are doing everything that we can to be sure that we are using our funds well. And we are creating, as I said in the answer to the prior question, resources and information available to show and be transparent exactly on how we are using those funds.
Thank you. Candidate Santiago.
Thank you. I agree. I don't believe we would need to request those additional resources from taxpayers. In that way, I think that the health district needs to focus on being good stewards of the funding that we do have available right now. And absolutely with my background in grants management and community engagement, I agree with what Tottenham Burris was saying about exploring additional options that are potentially still on the table. So, yeah.
Thank you. Candidate Peterson.
Again, I pretty much agree that everything I've heard and looked at and seen is how lucky we are that there is some I'm not thinking of the word and that happens, but that there is enough there for what we need right now. And at this time, there's no need to ask for additional funds for what we are doing, but we do need to look creatively at what those funds are doing and the priorities that they need to serve. I'm never saying never if our funds and federal funding and all this continues to decline and we find more gaps and gaps and gaps in our community. I think we'd have to reevaluate, but at this time, I don't foresee that as an issue.
Thank you. Candidate Thielen.
Well, first of all, because of what's happened with property assessments, there's been a very, shall we say, robust amount of money that comes from levies. That funding is not a problem. Also, the district, I believe, has quite a reserve right now. There was, as I looked at it, $2 million of vacancy savings last year that went into the reserve. So I think there's plenty of money. I think it's more us, the health district being good stewards of the money, being worthy of the money, and proving to the taxpayers that the health district is one of the best investments they could possibly make because these are services that make the community healthier. Thank you.
Thank you. And Candidate Thielen, we're going to come right back to you to start this next round. The Health District has worked to fund partners, as we've already talked about, to address community health needs. In the future, which areas of need would you prioritize for funding and why?
Oh, that's a really good question, too. First of all, some of the decisions that have been made are very curious. At the February board meeting, there was a contract to pay for a pharmacist at Salud, and I'm sure that's a lovely thing to do. And in it, it said the board was moving from staffing to funding partners. At the same time, the next day, they were laying off 2 preventive health nurses. Now, how did you balance that, the 2 preventive health nurses and the pharmacist at Salud? I think there has to be more thought given to how these decisions are made. The same issue is with the basically dismissing all the employees that have been providing services in the family medicine program and saying they're just going to give money back to UC Health and they can hire whoever they want. Not a good idea.
Thank you. Candidate Peterson.
Would you repeat the question?
Sure. The Health District has worked to fund partners to address community health needs. In the future, which areas of need would you prioritize for funding and why?
Yeah, again, I do think this is a loaded question. Priorities change as the district and our community changes and evolves. I do see that there has been a change in providers and the funding for that, but I also see that there's funding there, especially in the behavioral health system. And so I would like to see behavioral health funded. I think in that community needs assessment, one of the main things that we saw that was an actual still need high up on that priority list was behavioral health. That being said, dental is very important. It has to do with our cardiovascular health and everything else. And dental care includes implants and really expensive things. And you have to really balance. It's not a apples to apples comparison.
Thank you. Candidate Santiago.
Yes, thank you. I think this really depends on community needs, as Candidate Peterson had mentioned. Community health and needs are constantly evolving, and in order for us to figure out what areas need priority funding, we should be asking the community. In my personal opinion, I believe that bolstering existing services is always an area that needs to be focused on, and funding should be focused on that: behavioral health, dental health, preventative. I would also like to see some additional prevention education going out into the community and bolstering that up as well. Thank you.
Thank you. Candidate Field.
In terms of priorities, we've set the priorities as behavioral health, as dental care, and as access to care. I think that we need to keep viewing this through the health equity lens and in doing what we can to ensure universal access. One of the things that we are moving forward with in the health district is direct contracting of partners, with the start with existing partners, UC Health, Summit Stone, Salud, among others. What my understanding is, what they have told us, is that this will allow them to have a more nimble use of those funds, and it will allow us to have increased, more accurate data on how those funds are being used, while cutting through some of the unnecessary bureaucracy that has previously existed. Looking at this through a health equity lens, what we are doing is giving universal access.
Thank you. Candidate Totman Burris.
Thank you. I will agree strongly that this is really about health equity. And so I think it's also about maintaining relationships with our existing partners. And so that's something that we should continue working on, certainly with UC Health, Summit Stone, Salud. And then when we think about access to care and certainly behavioral health, that we should be reaching out to partners that we haven't reached out to before, or fostering relationships we haven't before, because there are populations and communities in Fort Collins that feel as if they've been underserved, and perhaps those are relationships that we need to foster. And so I think that's something as a board we could help to do outreach at. If I'm elected, I think that's a priority, certainly for me and those underrepresented populations. Thank you.
Thank you. And Candidate Strand.
I agree with the need in the behavioral health, access to care, and dental services area, receiving resources. I think that partnerships are essential and really important. But I do think that we need to hire and retain a qualified staff that are able to flex to meet needs. I think examples of that have occurred in the past when we needed to cover COVID responsibilities, when we had a meningococcal outbreak at CSU and needed assistance in staffing. And we had staff available not only at the health department, but with the health district that could come in and perform services that you can't just get from any nurse or any provider. They need to be there, and they need to be flexible, and they need to be educated. Thank you.
Thank you. All right. Well, the next question is kind of going along on this theme, and Candidate Peterson, we will start this round with you. How can the district assure that equitable healthcare access is provided to all community members? Please include your idea in supporting individuals losing their Medicaid coverage.
Yeah, losing Medicaid coverage, this is a real thing. And I think providing that access to insurance coverage where people can come in and use the services to find what other coverage might be available to serve that gap is essential. Could you repeat the question?
You bet. How can the district assure that equitable healthcare access is provided to all community members? Please include your ideas on supporting individuals losing their Medicaid coverage.
Yeah. I think the other piece to that, which I touched on previously, is we need to communicate in a way that people that have lost these services actually know where to find them. And this includes maybe increasing on social media in ways that other people are really interacting so that they understand where they can find help to bridge that gap.
Thank you. Candidate Thielen.
Again, a great question. There are some things that the district used to do that's no longer doing. And that had to do with going into communities that had lower income or are kind of deserts for health care and providing services, providing health screenings, providing blood pressure, providing cholesterol testing, et cetera, vaccinations. For some reason, the district has decided that kind of equity, and it really was equity, going into, I had a list, it's not in my brain, of the places that the medical staff would go into and provide care. Now that is equitable, and it's not being done anymore. So I'm not sure there's real, shall we say, action behind the words. Thank you.
Thank you. Candidate Strand.
I believe that many of the people needing care, equitable care, are hidden in our communities, and that we often do not hear their voices. And if we don't go into those communities, we are not going to hear those voices. We also have a time when people are afraid with what is happening at the federal level. We have people who speak Spanish that are very frightened about just the fact that they speak Spanish, even if they are citizens. We need folks that they trust to talk with them, to get them in, to be able to access the resources that are available. The people that have lost their Medicaid may be able to get back on Medicaid with proper help and support. And that needs to continue, as well as educating them about other health resources for them to participate in.
Thank you. Candidate Totman Burris.
Thank you for that. I agree that there may be ways for folks to be able to access their Medicaid still. I have had the experience of being on Medicaid and accessing food stamps, and it's a real pain. And so I think that the Health Connections program can help and be expanded, possibly, and take a look at effectiveness and how that program is being utilized, because it can be really tricky as a community member to get to access those services. And so I think that can be one way that the health district can ensure that people are able to receive their care. And I agree with candidate Strand that people, because of federal issues, that some people may be frightened and may need support within the communities that they trust. And so I think, again, expanding partnerships would be important for serving those who are underserved in our community. Thank you.
Thank you. Candidate Field.
Would you repeat the question, please?
Sure. How can the district assure that equitable healthcare access is provided to all community members? Please include your ideas on supporting individuals losing their Medicaid coverage.
In terms of equitable healthcare access overall, I think a lot of that is information and making sure that people know what resources are available, but it's also information back to us from our partners in terms of who is getting service and how those services are being achieved. In terms of losing Medicaid coverage, there was a profound post-pandemic removal from the rolls. We partnered with a number of different organizations in the area to make sure that people knew what they needed to do, the steps they needed to take to get back on the rolls. I think we can recreate that and may need to do that with even greater outreach at this time, given the risk and given the fear that many people may have in terms of coming into a government, what is seen as a government agency for assistance.
Thank you. Candidate Santiago.
Thank you. I really appreciate the sentiment about the community that is feeling frightened at this time, especially the Spanish-speaking community. Even in my circle of friends, some of my Spanish speakers, some friends of mine who don't have health coverage at their jobs, they have no idea what the health district is. So I think we're missing a big opportunity and a very vulnerable population who is losing their Medicaid coverage. With that being said, I think that a tailored approach needs to be implemented to reach each given community. I have ideas about how I would reach my Spanish-speaking community, who's the leader in what community organizations are leaders in the various communities that we are trying to reach. How can we tailor that approach? How can we put it in language that is easy to understand, digestible, and make it something that's not scary? Thank you.
Thank you. And candidate Santiago will be coming right back to you with this question for the next round. What kind of mental health and behavioral health services does the health district currently provide? Do you think the same services should be provided in the future, and do you recommend any changes in program delivery methods?
Thank you. Can you repeat that question? That was a very wordy one.
It was a wordy one. Okay. What kind of mental health and behavioral health services does the health district currently provide? Do you think the same services should be provided in the future, and do you recommend any changes in program delivery methods?
All right, thank you. Currently, right now, the health district is offering mental and behavioral health services. I know that we work with Summit Stone. There's also been, we've worked with other organizations that have worked with children. And I believe that the health district should continue providing those services, absolutely. And as I mentioned earlier, bolstering those services. And I think with Summit Stone being a strong partner, looking into more ways of how we can keep that staple in the community.
Thank you. Candidate Field.
Would you mind repeating? Sorry.
Not a bit, no problem. What kind of mental health and behavioral health services does the health district currently provide? Do you think the same services should be provided in the future, and do you recommend any changes in program delivery methods?
Mm-hmm. Okay. In terms of what we currently provide, we partner in a very robust partnership with Summit Stone. We also provide direct services through Kayak. In terms of what we provide and what we should be providing more of, I'll put it in that phrase. We should be providing more consultation with medical providers, including families, doctors, school officials, the family medical clinic at UC Health, Salud, all of those folks that we partner closely with. We should also offer and continue to offer evaluation services, particularly for children and adults who are experiencing mental health issues. That access needs to be made to be universal and as broad-based and efficient as we can make it. Services have not been cut, and we are looking to grow those service areas.
Thank you. Candidate Tatman Burris.
Thank you so much. And I just want to echo what other candidates have already said, certainly around partnering with, certainly continuing our partnerships with our current partners, with Summit Stone, and I think more consultation and moving towards a model with partnerships, more with Poudre School District especially. I know growing up and going to Centennial High School, we had an in-school clinic that was really important to a lot of the students that didn't have access to other care. So I think looking at models that look at different models for health and different creative models with partnerships there. And then, yes, I think those behavioral health and mental health services should continue with the health district and are currently, and that the contract model also is a good way to look at compliance and look at data coming back through those partnerships. Thank you.
Thank you. Candidate Strand.
Yes, I think that we do need to continue the services that are being provided. I think that Summit Stone is a wonderful partner, but they also got hit very hard with the Medicaid reductions and how many staff they could retain, so that the needs are even greater than they were before that happened. We need to be sure that we can provide the psychiatric services. It is extremely hard to find psychiatrists that will provide services to this low-income population in the community. And we definitely need to understand the expertise between pediatric psychiatrists and adult psychiatrists, and they are very different. We need to get quick evaluations. It is not easy for people to get in a short period of time. I've heard people crying that they couldn't get in for many, many days when they are in crisis. Thank you.
Thank you. Candidate Thielen.
Well, people have already said what the services are. There's kayak, there's connections, and there's also funds that will be going to the university health, UC Health, to provide services within the family medicine program that has been in the past done by staff, mental health staff from the district. So those are the current services. There used to be addiction services as well, but I think it's been a while since that's occurred. So that evidently is being done elsewhere. So as Abby said, the lack of psychiatrists is a huge issue. Right now, the district has lost both psychiatrists. They don't have a medical director. They lost a nurse practitioner. Of course, it got rid of the nurses. The ability to provide services is really being hurt, and there's a big loss in therapists right now. So they need to fill those positions.
Thank you. Candidate Peterson.
Yeah, I think we need to absolutely continue with the services that we have and also fill in with the services that have been lost. I do know that we need to encourage these partnerships. Those matter. Things like Summit Stone also, though, don't take all different payer sources, and that's an issue. We need to work with our underserved. But I can also tell you that even people with good commercial insurance really struggle to find behavioral health care. And not only do they struggle to find and navigate those services, but they're still really expensive. If you're on a teacher's salary and even if you have insurance, that access to the care is not there. It's really important to get timely services with accurate diagnoses because these can really change the trajectory of someone's life.
Thank you. So we're ready for our next round, and candidate Field, you will begin. So here's the question. What can the health district do to increase awareness of the existence of the health district, the services, programs the district provides, and events like board elections now that the print newsletter is no longer distributed?
Mm-hmm. We live in an era when people are on their phones, people are on their pads, people are on their computers, and that we need to go to where people are getting information. One of the things that I think the health district has done in recent months is to expand its website, providing more transparency in terms of the information of what we do and how we do it. But that we can't stop there. We can't just rely on the electronic media. We need to be in the community. We need to be at community fairs. We need to be at schools. We need to be at events, letting people know who we are and what we do, because this is your tax dollars that we are using to enhance the health of the people of the district. This is a gift to the community, and we need to make sure people know what a wonderful asset we have here that is so unique.
Thank you. Candidate Santiago.
I love this topic about increasing awareness. I feel like I've been talking about it all night for the health district. So I think it was candidate Thielen who was talking about outreach in the community. People were there in the community talking about the health district specifically. As I mentioned, most of my friends don't know what the health district is or why I'm running or why I care. And I think, again, this is an opportunity for growth. As candidate Field said, these tax dollars is a great gift to the community. It's a gift that you all have put in place. And so, again, I think tailored approach is a great thing. And I also think that providing this outreach and knowledge and education in their language, in wording that's understandable, should be a priority. Thank you.
Thank you. Candidate Peterson.
Yeah, I think when it comes to awareness and really allowing people to understand what the health district does, I totally agree. When I start talking about the health district, people are like, "What is that? What are the services?" And again, these things really matter. And so, again, I've said this too, but finding those channels that our current community uses to digest and read information is really important, and being able to pivot when those change, because those change fast and we need to be able to pivot with that. So there's that kind of outreach, but there is also being on the ground with our most marginalized and underserved communities. But it's also important to understand that at any time, any of us can be in that vulnerable population. That can change fast. If you're receiving a mental health crisis, you are a vulnerable population in that moment. And that can be any of us in this community at any time.
Thank you. Candidate Thielen.
It is a challenge during this time to figure out how to reach people. And certainly social media is a big piece of it. I was not surprised. I think it was coming that they were going to stop the paper version of the newspaper that went out about the health district. What was that called? I can't remember. Compass, yes, that's the Compass, which was very useful in its day. It was hard for people to find out information this year about the election. I think all of us have worked hard to get the word out because it's been, they say, what election? And we need to focus on that. And also, the staff needs to get out in, you're not going to get that with all these contracts, but the staff needs to get out to the community as well as the board. The board needs to also be a spokesperson, a positive, cheering spokesperson for the health district, and talk to particularly community leaders.
Thank you. Candidate Strand.
I agree that the health district is often the greatest hidden gem in the community. And I often get the question, well, I don't know the difference between the health department and the health district and what do they do? And that's gone on for years. I believe that we really need to have a public information officer that designs, with the help of the board, a true outreach plan, put it together in a formalized process, and work with probably some of the people at CSU in doing outreach. We can have a lot of student power that can be used in a lot of ways. And we need to not only have volunteers, but we need to have paid individuals from the communities we're trying to reach, because often they're expected to do things for nothing when they don't have the resources.
Thank you. And candidate Totman Verse.
Thank you. Yeah, this is an issue. It's just something we certainly deal with. The city of Fort Collins is getting out services to the community and any information that we have. And so we utilize a lot of different channels. We have started working with our community connectors through our diversity, equity, and inclusion team to work with the Spanish-speaking population, especially to outreach to them and build trust, certainly with the city, and utilize things like WhatsApp and other apps that a lot of other folks may not use. And so I think those are some creative ways to get this information out to the community. I think also my background is in urban planning. I work a lot with affordable housing providers. And so I think it's also expanding the network of people that we talk to, not necessarily just in public health or traditional healthcare. And how do we expand those networks and communication? And I would agree that as board members, if I were to be elected, to move forward with that as well. Thank you.
Thank you. And candidate Totman-Burris, we're going to come right back to you for this next question. It is, what is the best way to determine whether health outcomes are improved in patients being served by the health district? Please explain, including your thoughts on the use of data in decision making.
Thank you for that question. I think that it is, again, it comes back down to health equity. I think we need to both look at data that is coming through as numbers, and we're saying, okay, who is being served here? What are the demographics of the people that are being served through, especially these contracts and partnerships? And then being able to have some of those conversations of how are we measuring health equity? How are we measuring those outcomes? Are we looking at those social determinants of health? Are we looking at the whole person and the whole community when we think about especially behavioral and mental health services through the health district? And so I think those are major ways that we can look at that and make sure that when we are working on those partnerships and those contracts, that those are being established early on and that those are being maintained throughout the life of those contracts and partnerships. Thank you.
Thank you. Kenneth Strand.
You know, this is always a very difficult area to get all of the data you need to show that you have really made improvements. But the first step is defining the expected outcomes. And once you have defined the expected outcomes, looking at the measurements that can be used to truly assess if those outcomes are taking place. And as we look at a total population, not just the individuals served, we also need to look at what is causing disease, disability, and death within our communities and seeing if those numbers are improving, changing, and are we the ones who are doing it, or is that someone else? It's very difficult to know whether it was their individual provider, the district, or the health department who did that. So sorting it out can be difficult.
Thank you. Candidate Thielen.
Yes, well, data is the heart of public health, and that's where I come from in my professional career. And obviously, the direct services should have an accountability data system that will tell everyone the information on who's being served, how they're being served, the cost of that service, even though they may not be charged. What is the cost of that service? I think that's important. And that's true for the dental and so forth. Those are important. And of course, the contracts are a little easier to deal with because you can build it right into the contract what you expect the accountability to be. But I also want to come back to that issue of assessment because there's a lost opportunity, and it's been a lost opportunity for a long time. The hospital is required to have a community assessment by the feds. The health department is required to have a community health assessment by state law. And then we're doing another one. Why don't we have those three organizations get together and do it together?
Thank you. Candidate Peterson.
Data is essential, but how we collect data and what that data actually means and is interpreted is really important. Obviously, it's important to ask the question of what outcome do you want? And I think that's easier measurable when those services are a part of the health district. There's actually some ways that we can do that better. When we are measuring our community partnerships, we really need to figure out how to do that. Every nonprofit or people that you partnership, they are accountable to their board, but they measure things differently. And so how do you compare apples to oranges and make sure you are understanding what effect we truly are having in the community with those partnerships? I think that's something we can do. but I think it is going to be difficult. And then also understanding that health is not experienced in a vacuum. So any data we collect should also include information about housing, clean water, access to food, and all these upstream needs that matters also.
Thank you. Candidate Santiago.
Thank you. I agree that the best way to determine outcomes is by looking at the data. I agree with candidate Peterson about the reporting from our partners. I believe that with that data, the information that our partners are reporting on, that should be clear and concise, and those expectations should be lined out in the beginning so that we are all on the same page of what we're looking at, what outcome we're wanting. I also, of course, have to mention community feedback. I think that is often an represented and overlooked opportunity for a lot of organizations when they are collecting data, is that individual community feedback. And so that's what I would add. Thank you.
Thank you. Candidate Field.
I would just echo what candidate Santiago was saying a moment ago. In terms of the contracts for services, we need to and will be building in assessments for that so that we can make sure that the standards and expectations and accountability are met, so that we can determine whether or not we are meeting our standards of health equity. The one other piece that I want us to keep in mind is that we have a tremendous resource here in our community with the School of Public Health at Colorado State University. And we've got a lot of resources that we can call on to assist us and in the health district and to assist our partners who are undertaking these amazing projects to help us assess, are they working, or are there things that we should be doing a little differently?
Thank you. Well, even given our little break that we had for technical difficulties, I think we are at the time when we should roll into your concluding statements. And so we'll do that. Candidate Peterson, you will be first after I read Candidate Hathcock's statement. So here's the statement from Candidate Hathcock. In closing, I want to touch on a key concern of mine. As we are all too aware, there is a growing mental health crisis in our county and local community. I see the health district as a vital resource to ensure that gaps in mental health care access are effectively addressed. Studies have shown that approximately 1 in 5 Americans, including children, have a mental health diagnosis in our country, with estimated wait times of 4 to 6 weeks to be seen by a mental health provider. Colorado has the third longest waiting list in the U.S. with an average of 66 days. In my clinical pediatric practice, Kayak was one of my most crucial community partners that I truly relied on a daily basis to ensure that our children could avoid such unacceptable wait times. With Larimer County being a mental health professional shortage area, the health district, with its mission of ensuring timely access to health services, will continue to be crucial. So thank you. All right, and so we will go on to Candidate Peterson.
First, I want to thank everyone for their time for being here, my fellow candidates here. The passion up here is amazing, and the want to serve is huge, and I feel great to be up here with you all. I wholeheartedly believe that I have a diverse background and a unique perspective that would really serve the board. I also think we're in uncertain times, and there's been lots of federal funding cuts, and there might be more. And we need to really be able to be nimble and pivot if we need to. Great forethought is needed, so that we do have that ability to pivot and change as needed with the evolving needs. As a board member, I hope to think creatively for solutions, and really identify solutions with strategic planning and best outcomes.
Thank you. Candidate Santiago.
Thank you, and thank you everyone who is in attendance with us. I want to mention three things specifically. I really strongly believe in servant leadership, and as a board member, I intend to hold that belief. I think that we get farther as we take that stance of servant leadership. We really get to elevate community voice in that way. And I believe that where the health district is right now with this kind of new way of doing things with granting and partnerships, I believe my background in equitable grant making and community outreach and engagement would be a really good fit, especially right now. Finally, I do want to mention and call out that, as I said earlier, there's incredible experience up here with the candidates, and I have deep respect for each candidate up here. I believe I bring a fresh perspective, and I believe that's needed in the health district.
Thank you. Candidate Field.
I have had the privilege of working with an amazing group of colleagues on the board for the past 3 years. It really has been my honor and my privilege to serve the community. And I have to say, I'm probably kind of a government service nerd because I left the court after 11 years and just couldn't stay out of public service. I joined the Health District Board because I care about behavioral health. I cared about behavioral health and started a wellness court when I was on the bench. And I wanted to continue that work. And that's why I came to the Health District. I have spent my time focusing on that and using my skills that I gained as a judge to look at evidence, to assess information, and to make sure that we are following the laws, rules, regulations, and providing good governance and good stewardship for your dollars. Thank you.
Thank you. Candidate Tatman Burris.
Thank you. I would just echo what others have said, that it's been a wonderful opportunity to be up here this evening, and thank you so much for those who have attended tonight. Just really appreciate the conversation. I think my background in understanding as a community member of Fort Collins for a long time, understanding and having deep gratitude for this community is huge for me. And being part of the local government has really helped me to understand community development in this community in a particular way. I think also health equity is a top priority for me, but that comes from a background in urban planning and community development. And so I would like to bring that expertise to the health district as well. And then I also believe my experience in the community through Centennial High School, also as a single mom, makes me, I think, uniquely oriented to some of the unique needs within the community. And so thank you again for the opportunity.
Thank you. Candidate Strand.
I also would like to thank you for this opportunity, and I'd like to tell you just a little bit about my background. I was on the originating board that started the food bank for Larimer County. I was on a small committee that we just developed ourselves that worked with the city of Fort Collins to build Inspiration Playground, the All Abilities Playground at the end of Horsetooth. I was on the Poudre Valley Hospital Foundation Board when we developed the Cancer Research Center. I worked with the Robert Wood Johnson Foundation in developing the model public health statutes for the nation. I am currently the vice president for the Early Childhood Council of Larimer County, and I'm on the Larimer County Interagency Organization Group that coordinates services for high-risk youth.
Thank you. And Candidate Thielen.
Like Abby, I've been on a lot of boards, and I'm still on a lot of boards, and I like board work. I like board work because it's the board's responsibility to set direction and to make sure things are carried out properly. It's the board's job to listen, and I'm a good listener. And that's what I would promise to bring to the board. I'd also like to mention, because I see them in the room, if elected, I would be delighted to serve with Aaron and John, so I'm happy that you're here tonight. I think that the district really needs to kind of slow down, take a look, and make sure you're doing everything right. It needs to have capability. The turnover rate is horrendous. It's very misleading what's on the website. I can give you a list of 50 different positions that are turned over in the last 12 months. Thank you.
Thank you. Well, candidates, thank each of you for helping us to understand where you stand on the issues facing the Health District of Northern Larimer County. To our audience, both here and at home, thank you for taking the time to become informed voters. Election day for the Health District Board of Directors is Tuesday, May 6th, 2025. People may vote in person or by mail. To confirm your eligibility to vote in this special election or to request a mail-in ballot, visit the district's website at healthdistrict.org. You may also request a mail-in ballot by calling the Health District at 970-224-5290. The deadline to request a mail-in ballot is April 29th. Mail-in ballots are due in the district office by 7 p.m. on May 6th. Polling places will be open on Tuesday, May 6th for in-person voting from 7 a.m. to 7 p.m. There are 3 polling places: the Health District office at 120 Bristlecone Drive in Fort Collins, the Council Tree Covenant Church at 4825 South LeMay in Fort Collins, and the Wellington Area Chamber of Commerce at 8129 3rd Street in Wellington. These addresses are available on the district's website and will be available soon on vote411.org. Again, the Health District website is healthdistrict.org. And that brings us to the conclusion of the forum for candidates running for the Board of Directors of the Health District of Northern Larimer County. On behalf of the League of Women Voters of Larimer County, we thank you candidates, the League volunteers, FCTV staff, and our audience for joining us this evening. I'm Jory Kramer. Let's go vote.